Yes, welcome to this special Nurses Week video featuring some amazing nurses who are making a difference in the lives of their patients and their communities. This video will introduce you to few extraordinary nurses who are truly inspiring, from sharing their experience, their challenges, and so much more. Endeavor to watch this video till the end. Before we get started, do support this channel by clicking on the subscribe button below. Thank you. Now stay tuned.
I don't actually have inspiration before I started nursing school. I just went ahead. Then my dad was very passionate about me furthering my education, so that was my inspiration. Once I wanted to make my parents proud, I applied for mini school seriously, and I was not given admission, and I got admission into the College of Nursing, and we just grabbed the opportunity, not knowing what nursing is all about, not knowing what I'm going to do in nursing school. But after then, I think a few months into the program, I started developing interest, and I was inspired by what I see, and I try to know what nursing is all about, and that's when I got the inspiration.
When I was in secondary school, I do follow my mom to work. My mom is a record officer in a general hospital. General hospital is Tabulu. So anytime she's on night duty, I'll follow her to work. She'll drop me to school the following morning. So there was a time I followed her to work. We went to the nurses station to stay with the nurses over the night. Then we had a patient in labor around 1 a.m. So in a few moments, the nurse on duty started preparing for the delivery of the patient, and the patient delivered. As a young child, I was very happy, like seeing a live baby, like a newborn. The nurse actually delivered this baby. The mother was fine, the baby was fine. I was so happy. The families were happy, and I actually liked it. And I said to myself that I would like to be a nurse, so I'll be bringing live babies out of pregnant women too.
Okay, so what actually inspired me to become a nurse? For me, it was my JS2. I'll never forget. I went for this gathering, and it was a women gathering. So the person that was invited to talk on that gathering was actually a head nurse, a nurse veteran, and she was speaking so eloquently. She was talking about conditions that affect women gynecologically, and how we needed more women in the health line, and how we needed more nurses. And for me, that was just it. She was actually telling the women to actually encourage their daughters to go into health line, encourage their children to go into health line, because we need more nurses to be able to save ourselves and women in general.
What inspired me to become a nurse is, okay, as a child, I had a best friend who is crucial patient and is always in the hospital environment. So the day I visited her, the care I saw, the way I saw the nurse giving or rendering her care actually made me very, very interested in the medical profession generally. Even though I didn't particularly say, okay, I wanted to become a nurse that day, until my dad bought a calendar, brought it home 1 year, and the nurse drawn on the calendar looked exactly like me, and that was the day I said, yes, okay, so I want to become a nurse.
The one thing that inspired me to become a nurse is I have passion for this job, and I love helping people. That's one thing that always comes into my mind. This is my passion, this is my life, this is what I love doing, helping people when they need help. And if I'm in need also, I love people trying to help me out.
What inspired me to become a nurse is it combines my passion for healthcare settings and also my passion for helping others.
What I do is I try as much as possible to go out, even if it's once in a month. Like when I say go out, I mean take myself for a treat, go to somewhere that has fancy things to see, meet people, meet new people, interact, like just let myself go out into the world, even if it's once in a month, because the work can be stressful, it can be draining, it can be emotionally demanding, and you need to not forget yourself at the process, because you are also important. Your mental health is important.
There was a day at work when we had a patient in labor. She was already 10 cm dilated. She was on the delivery couch already, everything except just for her to push out this baby, and she was not cooperating at all. We had to persuade her, encourage her, pet her. We called her husband. The husband was crying, talking to her, but still the woman was not cooperating. We had to call other doctors, call other staffs on duty so they can hold her and tie her on the delivery couch before we can push out this baby. There are sometimes we have patients that are uncooperative. We just have to keep persuading them till everything will be fine.
I think one of the uncooperative patients I worked with was, like I said, I'm a midwife, was during delivery. As you know, during delivery, women go through like a threshold of pain altogether, back to back, and it is a very difficult time in a woman's life. And it was during delivery I met this woman. She was very quite uncooperative. I can't blame her because of the pain she was feeling, but she wasn't really listening to anything that was being said to her. It was like the pain was blocking all her hearing and thinking faculty all in general. But how I dealt with it was patience, lots and lots of patience. It wasn't easy, and at those moments, those are the moments where you need your patience to actually kick in.
There are so many patients, they are so difficult. I can't blame them for that, because most of them, due to the way they are feeling, their state of discomfort, maybe the prognosis of their disease condition that doctors told them about, they start passing aggression to their caregivers. And in this type of scenario, you also don't get angry. No, the thing is, they will make you angry. Like, they will do it to the extent that you'll be very, very frustrated. But my dear, once you see that they are frustrating you, you just calm yourself. Maybe you go back to your station. In the next 5 minutes, then you go back to the patient. And what do? You explain. Before doing anything on the norms, you need to tell your patient the rationale, the indication for doing that particular procedure that you are doing. You tend to have a chit chat. You build an effective relationship with an effective communication with your patients, so as to make things easier for you. This profession, we know you need to be kind, you need to be nice, you need to be this, that, but still, you should be more nice, more calm, and have the spirit of endurance.
Okay, let's see. When I was working in the NICU, you know how it is. I lost babies every single day. So the fact that I have to give out those babies to their mothers, looking at them, still haunts me. That was my most challenging moment. And let me say, the other challenging moment was when I was pregnant and I was working in psychiatric and female ward. I think I was just 2 months pregnant and I had PCOS, and the consultant kept on telling me that you are going to lose this pregnancy if you are not careful. And I had to do night shifts alone with 30 psychiatric patients, with 4 manic patients at their peak. So those moments were the moment that I don't want to lose the pregnancy and I want to do my job. So it's also so challenging.
Moments your emotion doesn't matter. Just the patient's emotion matters. And what I do to maintain my physical health is to always make sure I rest. Because whenever you don't rest enough, you're going to have your emotions all over the places. But when you do have time out of your busy schedule to rest, it helps me to actually contain my emotions at the time where my patients need me to be composed for them, because they cannot be.
People think nurses are rude, they think nurses are promiscuous, but I will say no to all these things. Anybody can be promiscuous. If you are just a nurse, that does not mean you are promiscuous. In a ward of 20 nurses, 20 patients to just one nurse, and just one patient has been disturbing you. Nurse, please come and see this baby. This baby is sleeping too much. Nurse, please come and see this baby. This baby is looking too much. nurse, please come and carry my leg. You'll be like, ah, madam, you're not the only one in this place. How about that patient? And the next thing they will say is, the nurse is rude.
My favorite part about being a nurse is ability to put a smile on people's face. The smile, a satisfying smile, it means a lot. One of my favorite and the most favorite parts of me being a nurse is the fact that I'm able to assist in giving birth, assist in delivering a new life. It's a glorifying moment for me.
Well, my favorite part being a nurse is being able to care for people, being there for people at their low times, being there for people when they really need help, and able to care for them and nurse them back to their good and great physical well-being.
Oh my god, my favorite part about being a nurse is I think I would say is actually seeing my patients get better, knowing that you actually walk this person through the hardest parts of his life or a moment where he was feeling low, and just seeing them be better. The glow on their face, the satisfaction on their face is everything for me.
Well, I would say my favorite part of being a nurse is having a deep conversation with my patient. When you do your job right, at least seeing patient coming to make of Thanksgiving to you after helping them out is one of the things that make me feel happy as a nurse.
Putting smiles on my patients. Whenever a patient comes to the hospital, they comes with a lot of anxiety, nervousness. After creating a rapport with them and reassuring them, that part of putting smiles on their faces, it normally gives me satisfaction. And at times, you meet people who praise for you, not just what you are in, but their prayers, and they tell you that you are doing well.
I hope you enjoyed meeting these incredible nurses and learning about the experience. Let me take this opportunity to say a big shout out to all the nurses across the world, my dear colleagues, for the hard work, dedication, compassion. I'm sending you loads of love and strength. If you are considering a career in nursing, let me tell you that you are about to embark on an incredibly fulfilling and rewarding journey. As a nurse, you have the opportunity to make a positive impact on the lives of others every single day. And to my dear potential nurses, remember that nursing is not just a job, it is a calling. It requires patience and a deep commitment to serving others. It is also a profession that offers endless opportunity for growth and advancement. It allows you to truly make a difference in the world. If you're passionate about helping others and are ready to take on the challenges and rewards of nursing, I encourage you to pursue this career path with all your heart. You have the potential to be an amazing nurse, and the world needs more people like you in this profession.
And we love you guys. Bye.
Thank you. Happy Nurses Week once again.
Happy Nurses Week. Thank you. Bye.
Happy Nurses Week.